neurodevelopment, children's ADHD, autism spectrum disorder, even things such as schizophrenia. We think that neurodevelopment is very much tied to microbial exposure in the womb, mum's microbial exposure, but then after birth. And we're losing our microbial richness, as you know.
Welcome back to the Mind-Gut Conversation. Today, I'm joined by Dr. Felice Jacka, Deakin Distinguished Professor of Nutritional Psychiatry and the founder and director of the Deakin University's Food and Mood Center. Dr. Jacka is a pioneer in the field of nutritional psychiatry, showing how diet and nutrition directly impact mental health. She led the first studies linking diet quality to depression in adolescents and conducted a landmark clinical trial proving that dietary changes can help treat major depression. Ranked among the top 0.1% of scientists worldwide for research impact, her work has shaped psychiatric clinical guidelines in Australia and has been cited in over 100 global policy documents, including those from the WHO and UNICEF. In today's conversation, we cover how close social interactions, particularly preparing and sharing meals, contribute to mental health, whether anxiety and depression rates are lower in regions where the Mediterranean diet is common, the strongest evidence to date supporting a causal role of diet in brain disorders, and specific foods that Dr. Jacka recommends for patients with anxiety or depression, plus her top 5 foods that benefit nearly everyone. Welcome to the show, Felice. I'm going to start directly with my first question, a very general question. So you're one of the faces of the new field of nutritional psychiatry. And for our listeners, could you explain what nutritional psychiatry is? I mean, many people know that, who know you, but a lot of people won't.
Yeah. So nutritional psychiatry is the study and practice, but primarily as far as research goes, it's a study that seeks to understand how diet and nutrition influence our mental and brain health across the life course. And then, of course, it's the translation of that into clinical practice, into policy, those sorts of things.
And how did you get interested in that space?
Well, when I was, it's an interesting story because, of course, when I came into psychiatry research, which was quite accidental, there was really no research on this topic. There were some very, maybe not such great quality studies, supplement studies or open label studies or epidemiological studies that sought to look at just one particular aspect of food, such as fish or omega-3 fatty acids or something. But of course, we don't eat just one food or one particular nutrient. And certainly supplements are in no way equivalent to diet. So there really wasn't any research looking at, how our daily diets, which are incredibly complex, one of the most, well, probably the most complex exposure we have in our life, might contribute to mental and brain health. And at around that time too, the field of nutritional epidemiology was advancing in its methods such that we were able to start to capture a better representation of the whole of people's diets, not just individual nutrients. But the interesting thing about psychiatry when I came into the field was that there really hadn't been any research that had looked at it properly. And it was really down to this paradigm in psychiatry, which is that everything that psychiatry was concerned with was above the neck. It all happened in the brain. It was all around receptors and neurotransmitters and things like this. But around that time, there was this emerging understanding that the immune system was critically important in mental and brain health, this field of psychoneuroimmunology. And of course, the immune system is profoundly affected by what we eat. Similarly, around that time, there was this emerging field coming out of neuroscience showing that there was a key region of the brain, the hippocampus, that was actually quite plastic and that actually grew new neurons through even adult life. And the animal studies were showing that this was profoundly influenced by dietary interventions. And then, of course, stress response system, we knew something about the gut-brain axis at that time, even though we didn't know anything about the microbiome gut-brain axis. And the gut-brain axis, being in the gut, there was a food link there, although it wasn't well described. And so for me, putting those pieces together, I thought, well, why isn't there a body of research that's looked at this, And I went to my potential PhD supervisor, who was a very, very he is a very well-known psychiatric researcher, Professor Michael Burke. And I said, I'd really like to look at this in this very large epidemiological study that was going on in the institute. And he said, well, sure. He sort of thought it's probably a dead end, and I don't know anything about nutrition myself or anything else, so go for it. And my background was psychology, not nutrition. So I had to do a lot of work to understand how to apply the methods from nutrition to, this field. But we had very, very good psychiatric data from this large cohort study, like proper psychiatric interviews and assessments. And so I did my PhD looking at the link between in this large, very representative sample of women, how what they ate might relate to their clinically diagnosed major depressive disorders and anxiety disorders. And I saw very clear links. And so this paper, my PhD study, ended up being really the first to show that there was this relationship between diet quality and mental health in women. And it was featured on the front cover of the American Journal of Psychiatry. And that was great because it gave me then the opportunity to reach out to many research bodies around the world, research groups where they'd collected data on diet and on mental health, but they'd never sort of put them together. So I was able to go around the world and work with lots and lots of different groups, and in that way expedite the development of the evidence base, at least from the point of view of the observational research. And then, of course, as a very early postdoc, I got funding to do the SMILES trial, which was very well known. So I got into it, I guess, because I was interested always in food. And I mean, really, who isn't? It was just this intriguing, it was like crumbs, where you saw these little indications that diet might be really, really important. And just following that trail, and that's how it all came to be. And then, I founded the International Society for Nutritional Psychiatry Research, and sort of the field has grown from there.
It's really remarkable that you single-handedly started a specialty that in some ways was so obvious in retrospect when you think about it, that nobody had thought about this. But it's kind of reflected also, I had the same experience in my training in internal medicine, that there was not a single lecture on nutrition or diet. So everybody deals with this every day, at least 3 times a day. But that science would take so long before they would actually address that question.
It seems crazy, doesn't it? I mean, nutrition is the petrol that fuels virtually every single process in our body and brain. And I guess it's something to do with the incredible complexity that you're dealing with. Diet, as I said, is probably the most complex exposure that all of us have several times a day. I mean, the complexity of food and diet is only just starting to be really understood, and we've focused for so long in nutrition on, macro and micronutrients, and maybe just a little bit on these, what we call antioxidants, these polyphenols, etc. But of course, that dark matter in food, the phytochemicals that we now think there might be as many as 150,000 of these, and how these might all interact with each other, with the receptors in our body that we've likely evolved to have, that complexity and how it all works together. And then, of course, you've got the food matrix in which the food sits, so the nutrition sits. So it's amazingly complex. And at the other end, you've got the brain, which is the most complex thing that we know of in the universe. We know almost nothing about it. I mean, seriously, what we do know is probably wrong, it's all our psychiatric drugs we found by accident, it's so complex that to get these two aspects of complexity together is kind of mind-boggling. And I do suspect that it'll take the advent of quantum computing for us to actually be able to start to capture that sort of complexity. But we're a long way from that at the moment. Having said that, the complexity of both those things, your mind, your brain, your body, and then food, yes, it's massively complex. And then you introduce the microbiome, which is a key player in all of this. And then you've got this added insane level of complexity. But actually what you need to eat to have a healthy body and a healthy brain is remarkably simple. And I
It's
think that's the thing. You don't need to even know about the science. You just need to, have some very basic principles about what you eat.
Yeah, this is another really amazing feature of this whole conversation that I mean, we basically know all the solutions. We
Yeah.
wouldn't have to do any other science and additional science to know what's best for us. And even though people like to have these controversies about the latest fad diet that they come up with, but in reality, if you're an objective person, you can look at things that we know pretty much everything today what our body and our brain needs. And we have
I couldn't agree more. Although the complicating factor, I think, now is the way we're producing food is so deeply suboptimal, and this is where I'm really focusing a lot of my attention now, although I'm very much an early, a dilettante, if you like, but I'm starting to hang out a lot with microbial ecologists and agriculturalists, and the way we grow our food and this industrialized food system that we sit in, Emma, it costs the globe at least $20 trillion a year. And it's because industrial foods, which of course make up about 70% of the food supply in the US, they are the leading contributor via their impact on chronic disease and high blood pressure, etc., to illness and early death. But then that same industrialized food system is the leading cause of biodiversity loss. And at the moment, the 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 people who do the measuring of these things, they're only looking at the biodiversity loss of, say, trees and large fauna. But actually, it's the microbial loss in the soil that we think is the major issue. The microbes, soil is the sort of largest repository of biodiversity in the planet. And when we apply pesticides and herbicides and fungicides and heavily till and monoculture, monocropping, you are losing that whole biodiversity. And once it's lost, it's very difficult to regain because it's an incredibly complex system. Now, the soil microbiome is the key driver of, we think, nutrient density and also phytochemical density. Now, these data around this are not even published yet, a lot of it. So I'm going on very, very early stage research, but it looks like it's a critical factor that we haven't really started to even think about. And then, of course, the microbes in the soil influence the microbes that we are exposed to in the air and in the environment. And there's some fascinating new research showing that environmental microbes and exposure to these can influence immune function, can influence anxiety behaviors in animals, but the data on the immune system from human studies in children in childcare, where they introduced microbially really active soil into the sand pits, the dirt pits that the kids play in, and showed that repeated exposure over a couple of weeks, infants had a much more diverse skin microbiome, and that correlated very closely with markers of immune function, better immune function. So the early research is pointing to the critical importance of environmental exposure to microbes, and it might be one of the key drivers of the benefits of green space and blue space, but what it does to our food when we don't have food grown in microbially rich soils, we're not even looking at this, we're not even considering this. And I mean, foods are grown in hydroponics now, which obviously is not in soil, but the soil itself is being really completely destroyed. And it's just one of I think I counted 11 different ways in which humans are taking themselves out of the food chain is by destroying the soil that gives us life.
Yeah, this is it's a fascinating topic. I mean, it falls into this concept of the one health, the one health
Yes.
concept that you know it's not just our health; it's the soil health and it's the planetary health. And when you
Yep.
look at closely, they're all connected. It's
Completely. And when and I think that this is where we're really focusing now. I've just set up this new consortium called the Grounded Minds Consortium, and it's working with amazing microbial ecologists, bioinformaticians, neuroscientists, agriculturalists, to look at how the way we produce our food influences mental and brain health. And here we're talking about critically important things: neurodevelopment, children's ADHD, autism spectrum disorder, even things such as schizophrenia. We think that neurodevelopment is very much tied to microbial exposure in the womb, mum's microbial exposure, but then after birth. And we're losing our microbial richness, as you know, very rapidly because of what we're doing to our environment and our food supply.
Yeah, the example that has fascinated me the most is this whole issue about, in the context of sustainable organic agriculture, that you actually, it's not just organic without pesticides, but you actually do something for the soil. And the evidence that the soil microbiome is a main determinant of the phytonutrient density in most plants, because, the microbes communicate with their roots, with this soil microbiome, and the microbes in the soil stimulate, for example, the polyphenol production. And so when we eat these plants grown in our chemical industrial agriculture, they look great. They look,
Mm,
colorful, big. They don't taste quite as good,
mm,
but they don't have these phytonutrients. That
no.
like the polyphenol is one large group of it. And yeah, this is a sort of a sad thing. Like, you can't even tell unless somebody educates you. That this beautiful looking fruit and
Mm.
vegetable that you buy in some markets is not healthy.
No, it's all surface, isn't it? The quality doesn't go below the skin. I think the work of Dan Kittredge and the Bionutrient Foundation is fascinating, and they've published early data showing that they've made a sort of a really simple, I call it a ray gun, but I think it's going to be the foundation of something that we'll probably all have in our hands and in our phones in the next 5 years, where we will be actually able to point it at a carrot or a tomato or something in the supermarket and compare the nutrient and phytochemical density of the produce with this. Now, once consumers have that in their hand, that is going to be a game changer, I think. And that's what we need, is the tool to allow us to all understand the difference. And that's going to drive consumer behavior, which will then really, I hope, drive a complete change in the way that big ag does things.
I mean, it is currently, as a lot of talk about like this "Make America Healthy Again" movement with Robert Kennedy.
Mm,
Um, I think it's a good discussion, because for the first time, but
mm.
it's contaminated by the people that are involved in it, which are not
Yeah.
credible, which
But
is not.
anti-scientists, really, and they're
Yeah.
focusing on all the wrong things.
But I think it's good to ride that bandwagon, that term,
Mm,
which really points out the main problem with our health, and that where this food comes from and how it's processed, and then how it's marketed. Um, I mean, we're dealing with all these diseases at the end of it, and
mm,
spending billions of dollars in healthcare systems that are keep growing and growing, because more and more people.
mm.
Well, medicine keeps them alive.
Yeah. It's a wonderful, wonderful thing, isn't it, for people who are, the late stage capitalists who go, well, this is great. We make this industrial food that makes everyone really sick, and then we can charge them to go to hospital, and we can charge them for their medicines, and we're just reaping it in, But
Exactly.
this is the thing. I mean, I'm cynical that any nation state government, even the US government, can make the slightest difference, because I've seen again and again, I think it's something like 70 of the top 100 largest companies in the world produce industrial food. It is the largest industry in the world, as I understand it. That has more power than any
Yeah.
nation state government, So I really, and then when you add in big agriculture, the Monsantos, etc., and they're all interlinked, of course, they're very often the same companies. They have so much power behind the scenes that I can't imagine even the president of the United States being able to make a real difference or a real shift. I think it's only when consumers change their behavior that we'll see anything change.
Yeah, I mean, there are some, I think some promising developments. For example, this Eat Well Foundation by Nora Latori. I don't know if you've heard of her. So
No.
they go um, into the kitchens of preschool and kindergarten and schools, and basically change the quality of the food at the earliest stage and teach the children and the parents, which is interesting, to
Yeah.
in what they should be eating. And it's been very successful. I mean, it's a nonprofit, and it's spread out. Started, I think, in California, it's spread out across the country. And this is a raising awareness in the people that need to hear it, parents and their
Yeah.
young children.
And the young children who are very soon going to be producing their own children. And we know that in the US, something like 60% of children alive today will be clinically obese by the time they're in their 30s. And this is when they're producing children. And that is really sounding a very big alarm bell for the next generation that comes after that. We have similar programs in Australia that are a much more smaller scale, but I think I've got a really interesting bit of data for you, Emeran, and it's really at the level of pilot data. But we have a lovely pilot program called Farm My School near where I live. And basically, these two fabulous farmers who are passionate about regenerative farming approached a local principal, school principal, and they had a massive unused soccer pitch. And they said, can we turn it into a regenerative farm? And they got the whole community together over 24 hours. So they did it through the night to
Wonderful.
build this regenerative farm. And it's been going now for 3.5 years, and it produces food for the community and for the school community, etc. We'd love it if it could then inform a school lunch program, but we haven't got there yet. But I did a pilot study last year when I looked at the gut microbiome of 15 students at that school, and then the gut microbiome of 15 students at a comparable school close by that just doesn't have a regen farm. And then we also took soil samples. Now, not unexpectedly, the diversity, the microbial diversity of the soil at Farm My School was through the roof compared to that at the other school. But what we saw was that the kids at Farm My School, at the school that hosts Farm My School, had a microbiome profile that was much more reflective of an environmental microbiome profile and a more health associated microbiome profile. Whereas the kids at the other school had much more of a Western profile that was reflective of Western diets. So it seems like these programs where you actually have gardens and, even farms at schools may in fact be doing a benefit to the kids, not just because of the food exposure if they eat it, but just from the environmental point of view. So we're trying to get funding to do this and look at some school programs in Tasmania in Australia that have the gardens and the regenerative growing of the food associated with them, and look at the skin microbiomes of those kids,
Yeah.
because I think that that is telling us something very interesting and important in a non-invasive way. We don't have to get poo samples from kids, but we can rather just take skin swabs.
Yeah, that's really exciting. So let me switch my question to something. I mean, I sort of think I know the answer, but I would like to hear it from you and have our audience hear it from you. So you've published the results from several major studies showing a correlation between lifestyle factors, including dietary intake and psychiatric symptoms, particularly anxiety
Yeah.
and depression. So even though there are correlational studies and we know the shortcomings, they don't prove causality, do you believe the evidence is sufficient today to include lifestyle interventions as a component in the treatment of these brain
Mm.
gut disorders or psychiatric or psychological disorders?
Yeah. So we now, I mean, the number of studies, observational studies, so these correlational studies that have looked at dietary exposure and then in many cases later psychiatric conditions. So they take out anyone who's already got them and they look forward to look at incident psychiatric disorder or manifestation and show a very clear dose response relationship between those dietary or measures of diet quality and later mental health. We have so many of them. They're possibly, I don't know, more than 100, I don't know, but from right around the world and from right across the lifespan. So from what mothers eat during pregnancy, children in very early life, adolescence, which of course is a key time when people develop mental health problems for the first time, through adulthood to later life, where people very often can develop, say, depression for the first time as they age. We see a clear, consistent dose response in many cases relationship. So that's the observational evidence. Then you have a very large body of evidence from the animal literature showing an impact of dietary exposures on key regions of the brain, behavior, hippocampus, learning, memory. We also have a number of intervention studies now. So we have 4 randomized control trials, including our SMILES trial, which was the first, to show that you take people with even severe major depressive disorder, moderate to severe, help them to improve their diet with a dietary support from a dietitian, compared to social support, which we know is a very powerful and helpful thing for people with depression, and show that there's a major impact on psychiatric health. And again, very clear dose response relationship between the degree to which people change their diet and the degree to which their mental health improves. We have a new study from our team that's very important, I think, called the CALM trial. And that has shown over, I think, 8 weeks that diet and nutrition support by a dietitian, exercise physiologist, and then the other group had support from a clinical psychologist with gold standard cognitive behavioral therapy. Both groups, they were equally effective in improving depression. And this was done during COVID through lockdown so that everything was delivered online. We're now doing a national study in Australia of people with clinical depressive disorders and bipolar disorders. So basically what that showed was that diet and exercise support is just as effective as gold standard psychological support. As far as clinical guidelines go, the Royal Australian New Zealand College of Psychiatry, their clinical guidelines for the treatment of mood disorders, and this came out, I think, in 2022 maybe, or maybe even prior to that, has lifestyle as the foundation of treatment. So it has, dietary improvement, exercise, sleep improvement, substance cessation support as the foundation. And they call it foundational. So the point is you do that before you build everything on top of that. You don't do it instead of, in some cases, but that's the platform. Similarly, the Canadian clinical guidelines just recently, they have psychological support, psychotherapy, psychiatric medication support, and lifestyle therapy as their 3 pillars of treatment. And the World Psychiatric Association and the American Psychiatric Association have both, since 2024, had a theme. So I went to the big APA psychiatric conference in Los Angeles earlier this year. I did a plenary, I did workshops, I did a fantastic symposium with other people, and it was massively successful, but people were obviously really ready to understand the literature. And whilst we will, of course, always need more research and we're doing clinical trials at the moment where people are blinded to the diet that they're getting. So all food is delivered to them, which I think is an important part of the science that we need to do. We also produced the first set of clinical guidelines for the application of lifestyle care in depression from an international task force. It took us 3 years. We set up this task force and then produced 2 years ago the first set of clinical guidelines that can be used internationally in any context, any jurisdiction, that carefully grade the evidence and come up with a list of recommendations. Now, you touched on a really critical aspect of this, though, a bit earlier in our conversation, Emeran, and that is that clinicians, people who are medically trained, generally get at the most, if they're lucky, 2 hours of training in nutrition through their whole training. There's a big international survey a few years ago that showed that fewer than 1% of clinicians rated their nutrition knowledge as very good. And yet more than 40% of clinicians were recommending dietary strategies or supplements without any sort of training in nutrition. Now, this is a major issue. Our Food and Mood Centre, which, as I was saying before we went on air, is about 50 people now, and we're doing all sorts of research. We're doing a host of clinical trials in FMT, so poo transplants, so that's another conversation. But we also have this arm, the Food and Mood Academy, that is set up specifically for education and translation. Now, we struggle every year to fund that. It's not funded by, the national medical bodies or the NIH equivalents in Australia, because nobody funds this stuff. But we think it's really important. So we have a free online course in food and mood that people can do. They can just go to our website and they'll find it. It's enrolled more than 90,000 people from more than 190 countries around the world.
That is amazing.
It's amazing. And then we also worked with the Royal Australian New Zealand College of Psychiatrists to develop accredited training in nutritional psychiatry for practitioners that anyone can go and do. And then we work with the general GP body, national body, to develop training in lifestyle medicine. So more broadly, and it's particularly useful for people working in clinical health settings, that are not just individual practice. So we have those that people can go and do the training for very minimal cost, or in the case of the free one, no cost, because we think it's really important that people know what the evidence base is and what it isn't, where we don't have evidence and where things are being promoted where there is not a good evidence base. And it may be that it's just too early, or that, we need to do more research. But in some cases, we have evidence that it doesn't work, and then people need to know that.
There's obviously, talking about evidence, all kinds of supplements with beneficial brain effects and cognitive effects and anxiety benefits are being promoted. And I think for a physician or psychiatrist, it's a lot easier to say, okay, take this
So much
supplement.
easier. Yeah. But we know that there are multiple umbrella reviews, very detailed meta-analyses of nutritional supplement interventions in psychiatry, and very few of them have an evidence base. And the evidence base that is there is very soft, shall we say. And it's only ever adjunctive. It's something that you take alongside other forms of treatment, and it might be, a good quality omega-3 fatty acid, for example. But there are very few studies that support supplements. And why would a supplement really work if you're taking out, components from this incredibly complex thing such as food, and just taking one individual thing out of it and having it in isolation? I don't know. It may be that there are some things that are going to be useful that we find out in the future, but at the moment, I think the evidence base for nutritional supplements is pretty soft. There's a lot of potential, though, I think, in the probiotic space. And here I'm not talking about necessarily pills, but things, that you might find in kefir or good quality yogurt. So we've just finished a study that's hopefully published very soon, where we randomly assigned 40 healthy women, so these were not women with mental disorder or anything, they're healthy women, to receive either a sachet of yogurt that had a particular probiotic bacterium added to it, or a sachet of something that tasted the same, mouthfeel the same, but had no fermentation products in it, had no bacteria in it. And we did MRI scans. And so over 8 weeks, the women consumed this 130 ml tiny pack a day. And we showed after 8 weeks that even in healthy women, there seemed to be a benefit to the brain of this particular yogurt with a bacterium added that was probiotic. They had a larger hippocampus, and they had more functional connectivity between the hippocampus and the frontal lobe. And they had a signal for glutathione as well, more glutathione, which is the brain's natural antioxidant. So it's only a small study. We need to do it in larger to power it properly. But it was really impactful, I think, that in healthy people, such a small amount could have an impact on the brain. And then we also have a couple of studies in Australia that I think your listeners would be very interested to know about. And again, they were just PhD studies. They weren't hugely well funded, because it's always hard getting funding to do research. But in these two randomized controlled trials, the researchers recruited roughly 100 university students, and they recruited young, healthy university students. So people in the healthy weight range who normally ate a healthy diet. And in the first study, they gave half of them randomly assigned a very sort of saturated fat, sugar heavy breakfast, like a milkshake type of a thing, and a toasty with ham and cheese and lots of fat. And compared to something that looked kind of the same but wasn't as unhealthy like that. And then in the next one, they did the same thing, but they also gave people vouchers for like McDonald's and, Kentucky Fried and things like that, and said, please, for the next 5 days, just eat lots and lots of junk food. And they did cognitive testing on them. They didn't have the money to do MRI scans, but they did cognitive testing. And they showed that after only 5 days, there was an impact on cognitive tasks linked to the hippocampus. Now, I mentioned the hippocampus before because I think it's really important. It is the one region of the brain that we know actually produces new neurons throughout life. And in fact, it grows and shrinks in response to all sorts of things. People who are depressed, for example, on average, they'll have a smaller hippocampus and it gets bigger when they're successfully treated. We know from all the animal studies that dietary exposures like blueberries can increase the hippocampus and the proteins that grow the new neurons, whereas Western foods and saturated fat can reduce them. And I actually led the first study in humans to show this very close relationship, dose-response relationship between the quality of people's diets and the size of their hippocampus when they're older. As you age, your hippocampus shrinks, and of course you start losing your car keys and forgetting your kids' names and things like that. And we showed this very clear, very strong relationship between the quality of people's diets and the size of their hippocampus in older people. Since then, there's been 2 much larger studies that have shown the same thing, and now, of course, we're seeing these intervention studies around the hippocampus. The hippocampus is really key to learning and memory, but also mental health. We think it's probably a very important pathway by which antidepressant medications exert their influence. And so the fact that within just a few days, junk food in young, healthy people had an impact on cognitive tasks that are linked to the hippocampus is really critical. So their learning and memory that's hippocampally, promoted was reduced within just a few days. Now, happily, it went back once they went back to their normal healthy diet. But I think that's really scary.
For which of these disorders do you think we have the best evidence that dietary interventions have a clinically meaningful effect? Not just like 1%.
Definitely depression. And that's primarily because nutritional psychiatry is such a new area. I mean, we would love to have funding to look at schizophrenia and bipolar disorder or all sorts of things. And we hope to be doing that, but for the moment, most of the evidence is in depression, but it's very good evidence. I mean, I was senior author on a meta-analysis a few years ago where we looked at studies around the world where they'd done a dietary intervention of some sort, something that was aimed at improving dietary intake. And they happened to have measured depression and in some cases anxiety, but mainly depression. They just happened to measure those symptoms, but they weren't in people with clinical depression or anything like that. It was often in people with, a metabolic disorder or some other disorder. And the meta-analysis showed very clearly that dietary interventions improved depressive symptoms and that you got more impact if that dietary intervention was led by a nutrition professional like a dietitian or a nutritionist. Now, there was some data on anxiety in there. The signal wasn't as strong, but it could be because there were fewer studies that looked at anxiety. But again, in the ones that were just limited to those who a nutrition professional led the intervention, then you did see that anxiety was improved. But to date, by far, the most evidence is in depression. But as I said, there are clinical trials now, including our SMILES trial, where people with even very severe depression, I mean, in our SMILES trial, a lot of the people who came into the trial had been sick for many years. Most of them were on other forms of treatment, antidepressants, psychotherapy. But like many people, they just hadn't responded. Some of them had been, in a state of just lying on the couch, living on cigarettes and coffee and wine for years. They were really impaired. And speaking to some of them afterwards, they said that the Smiles trial just completely changed their life. Now, what we did with the dietitians did just what dietitians do. It was no magic diet. It wasn't any particular thing. It was sort of based on a Mediterranean diet. There was certainly support to consume more fish and more olive oil, extra virgin olive oil. But it was just to introduce more vegetables and legumes and things like that, and to very importantly reduce ultra-processed foods and sort of sweets and cakes and those sorts of things. Now, what we saw was and the dietitian just worked with people to worked with them so that they gradually set their own goals and they gradually changed their diet. It wasn't like coming in and saying, you've got to eat this way from day dot. Now, what we saw was the more people changed their diet, the more benefit there was to their mental health. It was a very, very clear and close correlation. What we also saw, which has just been published, is that people seem to get an extra benefit, particularly if they reduce their ultra-processed foods. So while on average there was about a 7-point reduction in MADRS score, which is huge for people who were in the dietary group, for each, I think, can't even remember what it was, maybe 100 grams or a standard deviation reduction in ultra-processed foods, there was an extra 2.5-point benefit, if you like, in terms of their MADRS score. So MADRS is a measure of major depression. So it seems that was really driving a lot of the benefit. It was actually taking out the stuff. Now, when we look at the observational data, and I think this is really important to understand, we see very independent relationships between diet quality and mental health outcomes. There's two aspects to diet. There's the good stuff, the stuff we know we really need for our microbes, for our brain. So that's fiber, whole grains, lots of different types of plant foods, these sorts of foods, the good stuff. Then there's the bad stuff, the ultra-processed foods, the things with added sugars and salts and fats, etc. Now, they're not just the opposite of each other. So we see studies in young people, for example, where they're getting good food at home, they're getting lots of vegetables and all those good things at home, but then before, during, after school, they're going and eating a whole stack of junk food. They're still showing an impact on their mental health or a relationship with worse mental health from the junk food stuff, because they're quite independent of each other in the observational literature. So this idea that you can sort of cancel out your junk food intake with a few vegetables or something, it doesn't seem to work that way. The other critical thing I want to say, Emeran, and I think this is so important, particularly in the context of the USA and your listeners, the whole public health conversation about diet for at least 20 years has been around obesity, as if obesity is everything rather than a marker of the food system. Now, the relationship between diet quality and mental health is independent of BMI. It's independent of body size. It exists at every level of body size. It means that even if you're in the healthy BMI range, if you have poor diet quality, there is still a relationship to your mental health. So it's not about diet. It's about diet quality. It's not about dieting. It's not about losing weight. It's about nurturing your body and your brain and your gut with the right foods. So forget about weight loss and focus on improving diet quality.
I mean, at least the obesity obsession, has a positive effect, because it brought many people that otherwise would have never changed their diet into a category that they're concerned about their health as well. But I totally agree with you. I mean, right now we have these weight loss drugs that are mainly taken for weight loss, not for metabolic health, even though they do that as well. But main reason that people, go on these drugs is really to lose weight. So I think and this is kind of another question I want to ask you. So I'm a little bit on the pessimistic side. I mean, there are positive things like these school kitchen interventions and like many of these educational opportunities that you have initiated in many countries. But I'm a little bit of a pessimist that we really can turn this aircraft carrier around, anytime soon.
Yeah, me too. I think we're I won't swear, but I can't see a way in which humans are going to survive what we've done to ourselves and to the planet. I mean, if you factor in all these other aspects of the food system like microplastics and PFAS and, BPA and I don't know, all of the different persistent organic pollutants and endocrine disruptors and everything else. And so many of them are coming from aspects of the food system, particularly the packaging, not to mention transport and all those sorts of things. I mean, um, I just don't see, and this real push now to more efficient forms of farming, such as hydroponics and things, I don't think you can recapitulate nature. I don't think you can recreate it in a hydroponic system. I don't think that you can just go, right, here's this new magic fertilizer that's going to fix everything. And that's what industry will do, because fundamentally what we are in a capitalist society is just walking wallets.
Yeah, yeah.
That's all we are.
Yeah.
And advertising is geared to making us feel that we're insufficient. So we must buy more of X, Y, and Z. And it's geared towards easy solutions. So have this supplement and this tablet and this, medication. It's geared towards making money. Behind it is always money. And money is absolutely the most powerful thing in a capitalist society, not people. People are just where they get the money from.
Yeah, I couldn't agree with you more. But given that situation and this kind of pessimistic assessment in the, at least in the short term, I mean, something could happen in the future that the situation gets so bad and we have pandemics and people at some point wake up, politicians and say we're going to have to change. But in the meantime, there's sort of a couple of relatively easier solutions. So you talked about the ultra processed foods. Some people don't like that expression. They say it's all sugar that's in it. That's really the main offending component. And
it's just so funny. I mean, if you just think about, you think about the complexity of food that we've talked around, the macro, micronutrients, the food matrix, but, those 150,000 phytochemicals, most of which we don't even map now. Those things are all destroyed in an ultra-processed food. They don't exist. Ultra-processed foods used to be food once, and then bits of them were taken out and, mushed and extruded and heated and changed and everything else. We've just done a study, right? This is a really nice example. People talk about ultra-processed foods and they say, okay, well, if it has vitamins and minerals and it's got a healthy or a nutritionally balanced profile because it's got no sugar because they've got artificial sugars, it's got added fiber, blah, blah, blah. That's fine. It's food, right? So we actually looked at this. We've got, and again, this is another study that will shortly be published with any luck. We took women living with obesity, 47 women living with obesity who, get put on these very low energy diets. So it's about 800 calories a day. And they get put on those diets often if they have to have surgery or whatever. And they are normally these shakes and bars, these meal supplements. In Australia, they're called Optifast, but, they've got different names all over the world. You just get them from the pharmacy. Now, they are normally nutritionally balanced. They have low sugar because they have artificial sugars. They have low fat, they have added fiber, they have added vitamins and minerals. So they are nominally food equivalent and nutritionally balanced. So not your typical UPF as we think of it, like a donut or something. And then the dietitians have made these foods that are the equivalent in terms of very low energy diets. They're still about 800 calories a day, but they're made primarily from vegetables and legumes. So very low ingredients from UPFs, and I mean, I think for me, the UPF thing is quite possibly around the additives like the emulsifiers that do such damage to the gut and artificial sugars, etc. But anyway, that's another topic. And so they had these either the food supplements or the real food, low energy diet for 3 weeks. Now, at the end of that 3 weeks, all of them had lost roughly the same amount of weight. We looked at the microbiome of the women who got one or the other. So the microbial diversity of the women who got the ultra-processed version went down like that, and then the microbiome diversity of the women who got the vegetables and legumes went up like that. So we're talking about very, very different effects on the microbiome, even though that ultra-processed food was supposedly nutritionally balanced.
Interesting.
Now, there's a lot that we could pick apart there. There's a million things that you could do differently. I mean, the fact that they were shakes and bars rather than real food, that like having texture that you eat, and I don't know, there's things around those that we already know, that the more monotone your diet, like the less diverse your diet, you're going to have an impact on the microbiome. But I think that that's a really important study that will set the scene for a lot more research looking at the impact, because if your microbes interpret ultra-processed foods very differently to how they interpret real food, which seems to be the case, that has all sorts of implications, because your microbes are everything. You know, the microbes are producing thousands of molecules every day if they get dietary fiber, polyphenols, the things that they need. And those molecules, those tens of thousands of molecules, are influencing everything from the way your genes express themselves, your metabolic health, you know, your body weight, your glucose regulation, your brain, your behavior. I mean, your microbes are running your immune system. You know, 70% of your immune cells are in the gut. They play a very important role in immune function. And you're eating ultra-processed foods that the microbes are not interpreting in the same way. They're not receiving in the same way. And they're certainly not providing the things that they need to produce those tens of thousands of molecules. Huge implications. So I think we need, of course, a lot more research into the mechanisms, but I do think that the microbes are probably going to be a really key way in which we start to understand the mechanisms of action of UPFs. So, you know, we led this big umbrella review in the BMJ last year that showed that of 70% of the health outcomes we looked at, ultra-processed foods, higher ultra-processed food intake was linked. So this is particularly early death, cardiometabolic conditions, and common mental disorders, depression and anxiety. Now, that umbrella review was tabled in the UK House of Lords. We had conversations with Bernie Sanders' office because he used it to try and argue for more research into, you know, UPFs. We can see this very close correlation between UPF intake and health outcomes, but we don't know whether it's the UPFs, aspects of the UPFs themselves, the fact that they don't have any of these, you know, phytochemicals or the food matrix, et cetera, and they have the emulsifiers, everything else, or whether it's just because they're normally coming with a whole lot of poor nutrition, you know, like sugar and added fat and salt. So we need to know, we need to understand how these things are working.
Yeah, I mean, I have these similar conversations with Robert Lustig, you know, whom I'm sure you know, that who really blames all the problems that we have with our diet on the sugar.
It's too simplistic, way too simplistic.
Even though that is functions in the meantime, because it's in such high concentrations in different forms, not in the teaspoon of sugar you put in your cappuccino, but, you know, it's hidden everywhere, the low
Yeah,
fructose corn syrup. And it certainly is a major, I would almost say, toxin in our diet, but it's certainly not the only
definitely.
not the only
It's not the only
explanation.
one.
Last question. So we touched on this topic before, GLP-1 agonists and similar kind of weight loss drugs. The first time that a medication actually had a reliable, pretty profound, you know, impact on obesity, and not just on obesity, but also on metabolic health and a lot of other things. I think that all the studies, the final data are not out yet. If it
Mm.
acts on so many different things, from substance use disorder to, um, yeah, I've forgotten now, you know, for how many things it has been implicated as a potential remedy. Do you see a place for these drugs in the overall discussion about diet and the negative effects that the standard American or the Western diet has had or has on the population?
Look, I think anything that helps people to improve their diet quality is obviously really important. And obviously, there's going to be benefits to health from weight loss if somebody's living with obesity. And we know that. So that I think is very clear. I think it's enormously problematic for an individual, though, if they just eat less, but they continue to just eat very, very poor quality food. But in the absence of any meaningful policy changes anywhere, I mean, you can argue that some places in Latin America have started to, put the warning labels on things that are ultra
Yeah.
processed and those sorts of things. There are some small policies happening around the world, but basically that massive food system, I don't know how we unpack that, without going right back in to primitive times. I just don't know how you unpack it. I do think that when we get the ray gun that allows us to measure the nutrient density of food at the supermarket or whatever, that's going to be a game changer. In the meantime, we have to do something, and the GLP-1 agonists are, obviously going to be beneficial. Are they a solution to things? God, no. I mean, they're just a Band-Aid. They're going to have some benefits for sure, but we need to change the whole food system.
If you had to make one recommendation in a very difficult and complex area, what main dietary change would you recommend to people? In simple terms, like
Evidence. This is based on the research evidence, which, is often limited because it is coming a lot from correlational studies, but there are many, many, many intervention studies with this particular exposure. I would say that whole grains are really critical. If you look at the nutrition literature across the world, and I mean, it's massive, the amount of research that's been done in nutrition, massive. The thing that comes out unequivocally over and over again as being the most important in terms of being tied to better health outcomes and as an intervention improving health outcomes, it's whole grains. And whole grains, of course, are a critical source of food for the microbes. So spelt and barley and rye and brown rice and quinoa and these sorts of things. I mean, I love legumes. I'm a huge fan of legumes. I think you can get them into everything so cheaply and so easily. But I think based on the research evidence, it would be whole grains.
interesting. Yeah,
Mm.
and it closes the connection with it's best for the microbes. It's food for the microbes. The
Mm.
microbes turn it into anti-inflammatory metabolites, and that's a major
Yep.
endogenous remedy for the negative effects that our Western diet has had on our bodies and our
Yeah.
immune system.
There's so much ignorance around this idea of carbs, carbs as if they're all the same. It's hilarious. I mean, microbiome food is complex carbohydrates. It's, things that have dietary fiber, so plants and that are starchy, whole grains, legumes, they are all complex carbohydrates that your microbes need to do what they do. You starve your body of carbs, sure, reduce the donuts and the useless carbs, the toxic, poisonous ones, but your microbiome needs complex carbohydrates to do what it does.
Absolutely. Yeah, I think we've come to the end of our time, Felice. It's been wonderful as always. I, I, I just love to be on such a similar wavelength with somebody without actually having the opportunity to communicate too often. But yeah, the wonderful advice that you give and insights are really. There's not many people that I know that could do it in a similar way and had such an impact on the field. Both
Yeah.
educational, research wise.
It's been incredibly satisfying to see the field develop, and we can see now that there's research studies going on all over the world, and that translation, I mean, the work's been cited in more than 100 very high-level policy documents, UN and blah, blah, blah. But what we don't see is any change to actual policy. So it gets cited, people are aware. The UN, World Mental Health Report now cites unhealthy diet as a risk factor for mental disorders, and yet we don't see any policy changes per se. But it'll come, I hope, maybe, although I probably do share your pessimism. But maybe if people understand that it's not about weight loss, which often is a very difficult thing to achieve, but it's around feeling better, having improved mood, being able to think more clearly, that might be a much greater incentive to change diet quality than worrying about body weight, which is very difficult
Yeah.
and stigmatizing.
Yeah, so maybe in 5 years when we meet again, we can update our
I hope it's not as long as 5 years.
so yeah, thanks so much. Really appreciate the time you took, and so
It's
looking
great
forward
to
to
talk to you, Emeran. Lovely to see you. And yeah, I hope we do see each other again in person soon.
Okay. Bye-bye, Felice.
See you, Emeran.